everyone who's not on our panelist speakers, turn off their cameras for now so that we can have also the ASL interpreter in focus. Thank you so much. We'll be starting shortly. Hafide and good afternoon. Thank you everyone for joining us this afternoon for our Zoom press conference. I'd like to acknowledge the presence of our Magahaga, Governor Leon Guerrero, as well as our Public Health Director, Arthur Sinagastine, and our Guam Memorial Hospital Administrator, Lilian Perez-Posadas. I'd now like to give the floor to our Governor for her remarks.
Thank you very much, Crystal. Half a day. Throughout the course of our response to this pandemic, it has been my duty as your governor to announce when we have lost someone in the fight against COVID-19. It has been 129 days since I made my last announcement. And I have to wonder, as governor, as a community, and as a government, have we done enough to prevent lives from death? The individual was a 70-year-old male with multiple comorbidities. He was taken to Guam Memorial Hospital early this morning, and he was pronounced dead on arrival. He was not a known COVID-19 case. However, he was swabbed at GMH and his results came back positive. As we mourn this passing and celebrate his life, let us take a moment of silence. Reporting deaths is never easy, but we can easily forget that the numbers we report represent real people. We grieve for him and all the lives we lost in this battle. His sudden illness and death was not expected, and I have personally reached out to his family to offer our deepest condolences and sympathies on behalf of Lieutenant Governor Josh and the entire island community. This virus has already taken so much from us. If we do not remain vigilant, if we falter in our resolve, the price of this virus will be higher than we can ever pay. So before you go out, before you see friends, before you do any non-essential activity, ask yourselves, how much more are you willing to sacrifice?
Thank you, Governor. Lilian, do you have any remarks? Lilian, may I ask you to unmute yourself?
Sorry. Yes, we just, on behalf of our Board of Trustees and our employees here at the hospital and the management, we express our condolences and our prayers to the family for their loss. And so I'm available for any questions if there are any questions.
Thank you. Director Art, Do you have any remarks before our questions?
Well, thank you, Crystal. Like the governor, Governor Leon Guerrero, and of course, Administrator Posadas, I too, along with the Department of Public Health and Social Services staff, extend our deepest condolences to the family for their loss. And we are here with you, and we also extend our prayers to you. And we are also prepared to answer any questions with regards to our role as the Department of Public Health and Social Services.
Thank you. Our first reporter is Maureen Maritita from Mariana's Business Channel. You're welcome to turn on your camera as well as unmute your microphone.
Buenas, everybody. My first question relates to the number of current positive cases. We're hearing that they will be extremely high in the next announcement. Do we have any information on numbers?
I don't have any, I only have it of yesterday, Maureen, but Art might have some. Usually, usually the night before, public health reports the number of positives that they get from their own testing labs and from other reports from other labs. In the morning, usually there are other laboratories that also report. So usually by afternoon, we should have a number that would be from the night before and the morning. So Art, I don't know if you have any up to date now.
Governor, yes, thank you for that. With regards to your question, Ms. Maureen, we only have data as of the response or reports as of the 19th. And so we have 22 confirmed. Our year-to-date positive is 599. Today's information will not be closed out until tonight. And then our situational report, our SITREP, will be issued tomorrow for today's positives. I don't have any positives reported at this time to share with you.
All right, thank you, sir. Governor, I'd like to ask you my second question as well. It seems that the Secretary of Defense will be visiting Guam to meet with his Japanese counterpart. Do you expect to meet with him either by Zoom or in any other fashion? And if so, is there anything that you particularly will be focusing on in that conversation or requesting for the island?
I do know that he is making a visit to Guam, and I do know that the Admiral's staff and my staff are trying to set up a appointment to visit. I don't know whether it's through Zoom or face-to-face, but I do intend to, when we do meet, to again thank him for whatever help that the military has given us during this COVID pandemic, and to express also my thanks for the military being very cooperative and aligning with our protocols and aligning with our preventive measures, Maureen, to protect our island, as they are also facing an increase in their military population. I also would like to go over what the future is in terms of military buildup. What are the deadlines that he foresees, and how we are proceeding? Are we on time? The construction increase in activities here would probably also be a discussion. And of course, to again re-emphasize, Maureen, that you know, we expect the military to honor and respect our environment, our people, our natural resources, our heritage, and our culture. And That's very key, and I have never wavered in any way off of those conditions.
Thank you, ma'am.
Thank you, Maureen. Next, we have May Habib from K57.
Half a day, Governor. Half a day, everybody. Governor, hopefully you're recovering well, coming towards the end of your COVID term as well. I'm just wondering, you had said that we're going into PCOR 1 for 2 weeks and everything would be based on the numbers that we're seeing as to whether there's an extension or not. While we've seen, I guess, somewhat of a decrease, if you're comparing it to 42 new cases, we're still pretty high. Are you imagining that we are continuing PCOR 1 beyond the 2-week period?
That is a very strong possibility. And again, it's dependent on what results we will be seeing. The measures that we put in has only been less than a week. Closing the bars was one of the first ones, and of course, funeral restrictions together has not really been ongoing for more than a week. And so I'm hoping that by this weekend and early next week that we'll start seeing some numbers decrease. I think what we're seeing now is the effects of events that occurred or infections that occurred, transmissions that occurred maybe 2 weeks ago. And I know this anecdotally because people who are positive have told me that they felt they got infected at a bar about a week and a half ago, 10 days ago. And we do know that the contact tracers were also linked back to 2 funerals, which occurred 2 weeks ago. So I think what we're seeing are the effects of those transmissions and exposure. My greatest concern is what we're seeing at the hospital, and the my surgeon's cell general, Colonel Dr. Mike Cruz and Dr. Lewis Cruz and our team were talking about looking at alternative care facilities to, again, be able to catch the overflow and to be able to provide the ICU and the ventilators and the equipment that's going to be needed. So we are preparing for the worst. We're preparing for more increases May, and if that happens, it's very unfortunate, but we will deal with it and we will get over it. But it's more the anxiety, the nervousness, the being very scared that we will see more deaths. I do know, and Lynn can talk more about this, that we have more people in ICU and that we have about 2 or 3 on the ventilators. And these are not the older people. These are your young people. They're in their 30s. So that's a very scary situation. And we're praying every day, and I'm hoping every day, and I have sleepless nights anticipating that the numbers will start going down. I am afraid for our community, but we will, of course, step up as we have, and we will meet the challenge, and we will fight this. I have good people. We've been talking about this kind of increase, and I feel that we are prepared. I hope we don't ever get to that point where we have to use hospital tents, and we have to use our Blue Met tents, and we have to improvise, and we have to use all of our 79 ventilators. I am praying we don't get to that level. And how we don't get there is dependent on all of us. Dependent on all of us really being very serious about this virus, as we are seeing things that is not good for our community at all.
Thank you, Governor. If I may follow up, at some point when you lift PCOR 1 and take us back to PCOR 2 or PCOR 3 at some point, do you not expect that this sort of thing would happen again? I mean, we got out of PCOR 1, we went to PCOR 2, then PCOR 3, and then you're talking about bars and funerals. People will have to get back to some sort of normalcy. Are you worried that we're just going to get back into this and then have to lock down over and over?
We have to do what we have to do, May. And again, that is dependent on the responsibility of our community. I'm telling you, when we were recovering, we were recovering at a very, very good speed and a very, very good recovery. We've opened primarily almost all of our activities. We did. And if our community wants again to go back, then don't follow the rules. But that's what happened. People got relaxed. People didn't wear their mask. And it's because they thought, oh, we're over it. I don't think we'll ever be over this. We always have to continue wearing our mask, social distancing till, I don't know, into next year. The US is saying 2 to 3 years. So we have to do what we have to do. And, that's how we're going to win it. We go back 2 steps and we move forward 5 steps. And hopefully that we move forward with many steps and not have to go back.
Thank you, Governor.
Thank you, May. Next, we have Nick Delgado representing Hit Radio 100.
Hey, Governor, how are you feeling? I know that last time we spoke, you had said that you're coming at the end of your isolation period. Is that have you been cleared?
I haven't gotten my certificate, but my the director at Public Health, Dr. Jenna Manglonia, set my time is my isolation time is done, and I haven't had any symptoms other than still feel tired in the afternoon, but that's part of the recovery. And I just have to say this, Nick, that I am very fortunate, extremely fortunate, that my symptoms were just very mild to moderate. And I thank the good Lord for that. I thank my family and my support for that. But I am very fortunate and very thankful and grateful that it wasn't as serious as it could be.
Yes. Thank you, Gov. And so this question, either for Art or for you, Gov, it has to do with the backlog of testing samples that were reported overnight. I'm wondering if I can get more information about that as to how many people are actually running these samples, and is that capacity being increased for number of testers? How many tests also do we have to date? So Art or whoever, if they can speak to the backlog in those questions, please.
I'll have Art because he has more of the details.
Sure.
Go ahead, Art.
Thank you, Governor. So Nick, to your question, to date as of this morning, we have about 1,500 samples that need to be tested. I do want to assure the community that your specimens are being preserved, the integrity is being maintained. They are being put in the freezer so we can still run the tests. In terms of lab capacity, we have our Guam Public Health Lab. We also have a contract with DLS. We're also working on another second non-public health lab, and we're working with GSA on that. And once we get that issued as a purchase order, we will have a second non-public health lab running tests for us. So we're looking forward to that PO. In terms of lab staff, I actually reached out to Pacific Island Health Officers Association, PIHOA. We have the CT on board helping with the lab, and so we're also moving staff within the department to assist. Estelle from our epidemiology and lab capacity grant is also assisting on the administrative side of the operations because the large number and increase of swabs that we have received primarily from our Saturday community testing. And so that's where we're at. We are building capacity, but we are also processing specimens throughout the day. We process them today, but we'll also be receiving specimens from clinics and our health centers. Another thing we want to share is that the health center up at North, we are using our Abbott ID now, so that will not be specimens added to the lab, but will actually be those who go through the Abbott ID will get their results in a shorter period. They'll be receiving a call back in perhaps 2 or 3 days. And that's where we're at.
Okay. And the number of tests that we still have on island?
Tests, as of this morning and speaking with the staff, we have 15, number of tests we have, you mean test kits?
Yes, sir.
Well, in terms of specimens, we have 1,500. Test kits, I would have to get back to you on that. I don't have that information readily available, but we do get our test kits every other week from CDC and also from the WHO, and that is for our gene expert. We receive 2,200 test kits every other week.
Oh, that's great. Just a follow-up question, if I may, to the positive results that we saw this week. Additional Guam police officers and government employees who are among those that are testing positive in these past couple of weeks, getting the virus. Does the administration have a plan for, I guess, safety and other essential agencies to ensure that the services they provide aren't compromised?
Yeah, so we have ongoing measures to keep our people safe. The frontliners are all given the PPEs that they need in order for them to do their work. I don't know whether these tests positives was a result of frontline work, or was it a result of families, contact tracers through family? I'm not sure how it is, but it is a standard that our employees are required to use PPEs to protect themselves when they are taking care of potential COVID patients out there in the community. And if they are frontline responders, they are given the proper equipment and proper dress to protect themselves as best that they can. At the workplace, we do have social distancing, and everyone is required to wear masks. And some of them are teleworking when the space is not such that we can do social distancing. And so every director has a schedule and a plan of how to protect their employees.
Thank you, Nick. Next, we have Heidi Gilbert from the Guam Daily Post. Heidi?
Good afternoon, Governor. Since we're talking about health, have you signed the Guam health insurance plan? What's the anticipated cost to taxpayers, and what impact will it have on the fiscal year 2021 budget?
I have signed it. I think the cost is, I'm not too sure now, might be about 110 million, 111 million. And the benefit of health insurance is budgeted in the benefit portion of our employees.
Governor, is that Aetna?
Excuse me?
The vendor. Just wanna.
It is Aetna. It is Aetna.
Okay. Thank you, Gov. My second question. What's your level of concern on the economy and any new plans to help Guam businesses survive for the island to preserve jobs and help the unemployed? Perhaps asking President Trump to just waive the 25% and we'll just get the $300 instead of $400. so we don't need to search for that cost sharing?
Sure. Of course, my level of concern about our economy is extremely high. And we'll do anything to work it so we can rebuild again our economy. But I also want to let people know that there are still many businesses that are considered essential that are open and still providing services, goods and services to our people. Again, construction industry is open. Essential businesses like groceries, pharmacy, healthcare, gas station, auto industry, the real estate, those are still open. So I'm working it so we can have as many as we can remain open, and also making sure that the risk of exposure and transmission is very minimal. As far as the loss cost compensation program, we have been talking with federal government, and I am made to understand and made aware that the disaster relief fund we will be given upfront. So it's not like we have to provide it and then they'll reimburse us. So in discussions with FEMA, the upfront cost for the 75% will be drawn or will be loaded up through the Department of Labor. I am looking for the ability to also pay the cost share. And the information is that this program will last for 3 weeks. And so the cost share of the 100 for 22,000 people is not going to be as extreme as I had thought it would be. So I am having my director of BBMR and also DOA look at what funds are available to be able to provide the 25%. Beyond 3 weeks is another question. And but we'll address it as it comes up. So I have asked Dave De La Sola to go ahead and apply for the program. And my understanding is once you apply and it's approved, it becomes available within 10 days. So that would help our people who, as a result of this second round of PCOR 1, whose businesses or employers have been closed or put on hold, it would help those individuals that are furloughed or are unemployed.
That's good news, Governor. So
Yes,
are
it
you
is.
looking at, yeah, is that are you looking at the CARES Act as source of funding for this?
I am looking at the coronavirus fund that is under the discretion of the governor. That is the source. There are also programs locally that we have implemented that hasn't been, and the deadline and the application is expired, and we still have some balance of funds in those areas.
How much is that the balance, Governor?
I don't know.
Thank you,
Thank
Heidi.
you.
Next, we have Jarek Sablon from Pacific Daily News.
Hi, this question is for Art. Art, what is the storage capacity for the samples at Public Health?
Jarek, on the storage capacity at the refrigeration system, I don't have that. I'll have to get that back to you.
I do know that this morning, Dr. Jenna Menglonia did say that there is the capacity, and that she's assuring all the people that the specimen will be kept intact and preserved. So we don't have to redo the specimens again.
And then my other question is for Lillian. What's the hospital's capacity for the ICU capacity and ventilator capacity?
Okay, the ventilator capacity, because we received initially about 34 ventilators from HHS, and then the second shipment was about 25. So we have 59 from HHS FEMA, and then we also have our own, ventilators that we've always been using. So we do have a capacity of like about 79 or 80 ventilators on board. Right now, we're using 3 of those ventilators on the COVID patients who are in the ICU Care 2. 3 of them are intubated and on ventilator support. In terms of ICU bed capacity for the COVID, in the Care 2, that's our designated COVID care unit, and it's for ICU level of care. There are 5 beds in there. However, because it gets kind of tight when you have the ventilators right at the bedside next to the patient, we've capped it at 4 instead of 5. We've capped it at 4. And we also have within the ICU non-COVID area, we have 14 beds available, but right now we're using 8 of those 14 for non-COVID ICU. So we have an additional 6 ICU beds that we've been meeting, and we just met this morning also to consider that we will then, divide that ICU area for COVID and non-COVID, so that way the non-COVID ICU patients will not be mixed with the COVID patients. So we're looking to use those 6 ICU beds for COVID if we need to. On the 3rd floor, which is our medical telemetry unit, there are 26 beds in that area. And right now we're currently decompressing that unit. We're moving all the non-COVID medical patients. We're down to like 9 non-COVID telemetry patients. We're moving them to another area in the hospital, and we're going to set up and get that 3rd floor telemetry unit to be the COVID Care 4, which will then give us more capacity of 26 beds for a combination of telemetry, COVID patients, as well as PCU, progressive care unit, level of care for COVID patients, and also ICU. So we're expanding our beds for the COVID patients in anticipation for more patients coming on board. And I just kind of wanted to also add to the governor's comment with regards to, in response to May Habib's question as far as patients in the ICU and on ventilators. It's a really serious concern because people now with COVID are coming with a higher level of critical care needs, meaning their respiratory system is really just affected so severely that they're so compromised that we really need to keep them on either a high flow nasal cannula, supplemental oxygen, to ensure that their bodies are getting the oxygen saturation that it needs, or that they are on a ventilator. So it's a pretty serious situation, what we're seeing with these individuals coming in with COVID positive. Their conditions are more acutely, critically ill. And all the more reason that we really need to enforce and follow through with what the governor is saying. Take this very seriously and prevent the infection as much as we possibly can by wearing all the time your mask and just really doing the social distancing, because we're seeing more and more individuals coming in with that serious condition. Thank you.
Next, we have Nestor Lecanto, KUAM.
Thank you. Good afternoon, everyone. Governor, could you elaborate? You mentioned that the 70-year-old man suffered a sudden illness. Can you elaborate on that? And are you able to speak about those multiple comorbidities?
I don't know any of that information. I don't know if Lillian does, but I do not.
Lillian, do you have any more information on that?
No, Nestor, as the governor said, we weren't given a whole lot of information other than he is 70 years old and, the family found him at home and brought him to the emergency room by ambulance. And so when he came into the emergency room, he was pretty much already breathless and unresponsive. And so, his body was tested by Abbott and it was positive.
Yeah, I guess what I'm getting at, and condolences to the family, of course. Can this be directly attributed to COVID or to the comorbidities? And so should it be considered a COVID related or COVID death?
Well, he tested positive for COVID, so he is a COVID individual. In terms of his death, what we were told was that it was a cardiac arrest. His heart stopped, and I guess, for a long time, was when he was found unresponsive, and so it is a COVID. Whether it was the COVID that caused the death, I can't say unless I'm not a doctor to say that. But the test result came back to be COVID positive.
Okay, and the next question. So Lillian, and this goes to the governor too. You mentioned that you're seeing a lot more serious cases coming into the hospital. At what point do you think and the governor has mentioned in the past that, and the admiral was on our air this morning saying that if the government of Guam asked, then the Department of Defense could respond. It would have to go through FEMA, of course, first. But at what point do you think we will need to engage the military to be able to get the, I guess it's a field hospital ready?
From what I understand in past communication meeting with the some of the officials that came to our facility, was that it's not just Guam Memorial Hospital, but it's the entire healthcare system. So it's a combination of Guam Memorial Hospital and GRMC with their capacity, and I think also with Navy. If we've maxed out our capacity level, then I think that's when they will send in the cavalry or the help of resources, because we all know that we are short of our health professionals, our nurses, and so that's my understanding. Is that will be the trigger point when the whole island's healthcare system has maxed out its capacity.
So, Governor, are you comfortable for now with what our current capacity is?
I am. I am comfortable, but how this virus work is, within the next 2 days, we may be busting at the seams. So I do know that the hospital tent that the Navy had when the USS Theodore Roosevelt was here and was set up, that infrastructure is still on island. And they left it on island for our use should we need to do it, should we need to use it. So it's right here, and even medical personnel can be also called upon to come in and help us.
Thank you, Nestor. Next, we have Chris Barnett from The Link.
Half a day, Governor. Half a day, Governor.
Half a day, Chris.
Gov, do you need to drink water or anything before we continue? Because I know you've been talking a lot.
No, I'm good. Thank you.
Okay, and Gov, I just want to congratulate you. We had you on The Link, and I remember you had said the virus is a bitch, and I'm just happy to see that you're showing this bitch who's boss. I just wanted to lighten the mood just a little bit, Gov. We talk about PCOR 1, so a couple questions back, you had reeled off all of the different businesses that remain open during PCOR 1. That being said, at least anecdotally, what we're seeing out here is it looks like PCOR 5 out there. I mean, there's just people all over the place. Do we need to maybe like revisit some of the places that are open, the types of businesses that are open, to maybe reduce the congregating? Because, public gatherings are prohibited, but what we are seeing are gatherings at, businesses. And I'm just not sure if COVID, discriminates between a business gathering and a public gathering. So if you could kind of address what we're seeing out here, which is totally different from the PCOR one we saw during the first lockdown. And then I also wanted to ask if you feel like, sadly, and our condolences to this family, but if you feel like this man's death could maybe galvanize people to take this this situation more seriously, because they're not.
Yeah, we've talked about this in our executive team this morning and a couple of mornings ago, that if we're not seeing the numbers, Chris, we are going to come back and put in more restrictions. Even to the point where if I have to do the roadblocks again, I am going to do the roadblocks again. And I don't really particularly care that the people will be upset, but if by doing that we can save lives, then that's what's going to happen. I'm hopeful that we don't get to that point, because we know how inconvenienced that is. But it is something that is of no reason that we should be out there traveling and acting like this isn't a serious situation. I think galvanizing, Chris, the people would be if it's affected with their own private lives. What about if their grandmother or their young child gets COVID and becomes seriously ill, that their lives end? That really shouldn't be what's galvanizing. I think the galvanizing of it should be our own sense of responsibility to ourselves, our loved ones, our family, and our friends. I know that your station has been very responsible, and I know you've done a lot of really good media awareness out there. And I thank you, and I thank your management and owners of your station, because that helps. That helps a lot. But, if we have to put in more restrictions, we will put in more restrictions.
Thank you, Governor. I really appreciate your kind words. And, I don't like how this community has become divided over what to me is simply a public health issue. I mean, I agree with you. It's about saving lives. On that note, we had the Admiral this morning on the link, and he's repeatedly said that, and you have as well, that the Navy and the military is standing by with the resources that we need in the event that we reach capacity in our healthcare system, which we're very close to doing by all accounts. And so the Admiral had, and I guess I kind of thought, that it was something as simple as like you call up the Admiral and you say, hey, we need this, we need that. But the process he described, it sounded pretty lengthy. And so I was just wondering if we're anticipating this surge, if all the doctors and Lillian and everybody, on the front line of this public health emergency is anticipating that it's only going to get much worse. Do you think it's prudent to maybe put in that ask now, in anticipation of how long it's going to take for those resources to make it to the island?
Yes. Actually, our Dr. Mike Cruz has been in communication with the Metcom people. And I do know that Admiral Manoni has been put on notice by Indo-PACOM that whatever we need to have, that they will come through with it. So as far as going up the ladder for approvals and so forth, I don't think that's going to be a difficult approval process.
Thank you, Governor.
Thank you, Chris.
Thank you, Chris. Last but not least, we have Ethan Perez from Pacific Island Times. Ethan?
Hey guys, how's everybody doing today? It's good to see that you're doing well, Governor, and I thank you for your time. Oh, sorry, my cat. I just ignored that. Anyways, with the large amount of cases that have turned up positive within the last few weeks, I just wanted to ask your opinions on the current system of contact tracing. Specifically, do you think the web that you guys have constructed is wide enough? Is it effective enough? And just in general, what are you doing to bolster up this very instrumental part of our COVID cleanup, so to say, even though now numbers are skyrocketing, but that aside, your response.
I'll have Art answer that because that's his area of
Okay.
expertise.
Art?
With many of our community listeners, and as we do different radio shows and interviews, a case always starts with a case investigation. And from there, it goes, people are identified from the index case, and then we go into contact tracing. So in terms of capacity, we have over 50 employees in public health and social services today who have completed their online certification for contact tracing. My last update with regards to our contact tracers is that we have sufficient. We haven't pulled on everyone at this time to do contact tracing. So it is showing that it is effective. And in addition to what they're doing, we've redirected, we opened up a new strategy rather in terms of community testing. We're postponing community testing as we've announced earlier today, late last night. Again, to remove our resources so that we go target testing based on contacts that have been identified through contact tracing, folks who are symptomatic, our high-risk group, our elders, our inmates. And so that's our shift in the department right now so that we can focus on contact tracing. And in response to the number of cases that have gone up, in the last 7 days, we have 165 confirmed positive cases over 599 as of August 19th.
This is the last reporter,
So we are shifting our resources and our focus over to where the data is so that we're not casting a white net through the community. We've done that through many community outreach that we've done. And so now we're focusing on where the evidence is showing that we have to work with cases, our index cases and our contacts, all those index cases, the positive and the close contacts to the positives.
Okay. Thank you for that, Art. I have no further questions at this time. I hope everybody has a great day. Thank you.
Thank you, Ethan. Governor, for your closing remarks.
Yes, thank you everyone for being on this press conference. I'd like to thank Art and Leon for answering some of those concerns and questions of our media and our public. I also would like to say that this is a very sad day for the family who have lost their loved one to this COVID virus. And I think we should, in the memories of all those that have passed on as a result of COVID, that we should again adhere to the measures that we have put in place to prevent and minimize our exposure and transmission of this disease. And just want to again re-emphasize that although initially we had seen that this virus would most likely only affect the vulnerable individuals with comorbidities, but we're seeing different this time around. So please, for our children, for our families, and for yourselves, let's stay home. If you don't have to be outside or be anywhere, please stay home and help fight this battle of coronavirus. Thank you, and Sijus Masa.
Thank you everyone for joining us.